Hi, Mr. Nugent. This is Rhonda Steele with assignment number 6. Here we go. My name is Rhonda Steele.
I'm Briley.
Hi, Briley. I appreciate you coming in today. There's a few things that I need to discuss before we can actually get started, if that's okay with you.
Yes.
First of all, do you have any kinds of questions or concerns on why you came in today before we start?
No.
Okay, a little bit about myself. I have been a licensed nurse for the state of Ohio for approximately about 20 years. I've been here at Self Refine for a little over 6 months as a medication reconciliation nurse. My duty is to monitor clients' medications. I monitor attendance for physicians' visits, therapy sessions. Also, I call in prescriptions to the pharmacy. I do this on a day-to-day basis or a week-to-week basis, depending on whatever program works best for you. Do you have any questions about that?
Yes. What is Self-Refined?
Self-Refined is a state-funded program. It's actually a clinic that specializes in clients who have addictions to drugs such as opioids, heroin, meth. We design a program based on the client's needs, along with you, with medications such as Suboxone. We do counseling, either one-on-one, group therapy. We also assign a case manager to each client to help with community needs and referrals. We have a nursing team with an on-site lab for drug screens and then medication reconciliation. Do you have any questions about that?
Yes. Are we required to do a drug screen?
Yes, every time you come in for a prescription, you are required to do a drug screen just to monitor use. So that's a little bit about my job title. Now I'd like to discuss with you the concept of confidentiality. I'm a licensed professional. I will be required to safeguard your information, so whatever we discuss, I will, to the best of my ability, to keep that private. Since this is a group counseling atmosphere, we do have a meeting every morning where the nurses, lab techs, social workers, case managers get together, and we do discuss pertinent information to try to provide the best services for you. We follow the HIPAA law here, which requires us to safeguard your health information. We also are under the U2 CFR, which is a federal substance abuse confidentiality law that protects what we also discuss. There'll be a release form that I will have to have you sign at the end of the session, so we can determine what information you're okay to release and what information you're not okay to release. There is a few exceptions underneath of that law that I could be required to break confidentiality, such as the government coming in and doing an audit of our company, a medical emergency where you would collapse in the break or the waiting room, and I would have to call EMS. I would be required to give them some medical information about you. If you would come here and cause a disturbance, and I would have to call the law, then I might have to break confidentiality. If you would report to me any kind of child abuse, sexual abuse, domestic violence, then I would have to report that. If you report to me that you're going to harm someone or harm yourself, or if something would be a court order. Do you have any questions about confidentiality or the CFR policy?
No.
A little bit about our policies. You will be required to see a nurse or me every time you come in for a script renewal, which, like I said, could be one time a week, could be on a day-to-day basis. It is very pertinent that you see me. If for some reason you can't make it to your appointment, you are required to call and cancel at least 24 hours in advance. If not, you will not receive any kind of medications for that day. So it's important to reschedule as soon as possible to keep on track with your medication therapy. for some reason you couldn't make it to a morning appointment because your car wouldn't start, then you could actually call and we could try to fit you into an afternoon appointment. We try to be flexible like that. The fee here is $90 to $120 a session, depending on your needs and extent of the services that's required. As of right now, there is no cancellation fee, but after you have missed 3 sessions, then you're required to meet with our administrator, and it could possibly result in termination of the program. We are open Monday through Friday, 8 to 4:30, except on holidays. We do take first-time walk-ins. We also have a 24-hour crisis hotline that I will provide you with the number at the end of the session. Do you have any questions about that?
No.
Okay. Since you are here on your own recognizance and this is not a court order, then you do have the right to terminate services whenever you feel it's necessary. It's our right to monitor your safety of taking your medications correctly. So, for example, if you would come in to see me and I would feel that you're very highly intoxicated, then I have the right to withhold that prescription for that day to prevent a drug overdose or any kind of drug interactions. We are very concerned about your safety, so if there would be any kind of safety concerns that you would like to discuss, please feel free to discuss those with me as well. You will receive the utmost respect and service here, regardless of your race, religion, gender, or any kind of sexual orientation. Do you have any questions concerning anything that we have discussed or anything that I possibly might have missed?
No.
If not, I would like to thank you again for coming in. I do look forward to working with you. If you are willing to get started, I will need you to sign a few forms, including a consent to treat form. And is that okay with you?
Yes.
All right, thank you.